The external genitalia in the male would include the penis and scrotum. The penis is homologous to the clitoris. The scrotum is homologous to the labia majora. So, for instance, by the way, sometimes you can visually appreciate the homology. If you look at the skin of the scrotum and compare it to the skin of the labia majora, it's very similar. Okay, it's slightly pigmented. In some cases, it's heavily pigmented. It contains sweat glands, sebaceous glands. It may contain some hair follicles. Okay, so the structures are very, very similar. Okay. This is a mid-sagittal view. And what I'd like to do now is just to point out the structure so everybody's on the same page. This is the testis right here. Single would be IS, plural would be ES. Interestingly, I've heard some students here, even at the level of college, ask me a question like, are we going to have any testes at the end of the semester? Okay? They're using that word incorrectly. That means test, T-E-S-T-S. Okay? So make sure you use testis, testes, and test correctly. This structure that's hugging the posterior aspect and the superior aspect of the testis is the epididymis. The epididymis tends to be a little bit larger and thicker along the superior pole. This is referred to as the head of the epididymis, body, and tail. So when spermatozoa are produced within the testis, they then pass into the epididymis, where they're going to spend a few weeks. You can think of the epididymis as kind of a school where the spermatozoa learn how to swim and become a little bit more mature. When they're finally ready, they're going to pass from the epididymis, here from the tail region, into this vas deferens. This is the tubular structure. That's going to pass from the scrotum into the pelvic cavity. Notice it's going to move along the fundus of the bladder and then to its posterior aspect where it becomes a little bit more dilated. So this region here behind the bladder where the vas deferens is dilated, that's called the ampulla of the vas deferens. An ampulla is a dilated region of a tubular structure.
Can we call it the vas deferens?
You can, but very few people call it that.
And what is it called again?
The vas deferens.
Vas?
V-A-S. Okay. Now, notice there's a gland, an accessory gland sitting right next to the ampulla of the vas deferens. This is a seminal vesicle. We said the seminal vesicle produces secretions that accompany spermatozoa. Well, both the ampulla of the vas deferens and the seminal vesicle empty into this ejaculatory duct that passes through the prostate and then enters into the prostatic urethra. You see this tube coming from the bladder is the urethra. The part that passes through the prostate is the prostatic urethra. And so the ejaculatory duct is going to empty into the prostatic urethra. Okay. So we have seminal vesicle, epididymis, vas deferens, ejaculatory duct, urethra. There are actually three different regions of the urethra. The part that passes through the prostate gland is called the prostatic urethra. This little part here that passes through the pelvic floor, this muscular floor, which also goes by the term urogenital diaphragm. So the part that passes through the urogenital diaphragm is called the membranous urethra. But it's only about 1 centimeter or 2 long. That's the shortest portion of the urethra. The third part of the urethra that then passes into the penis can either be called the penile urethra, and that makes sense because it's passed through the penis, or it can be called the spongy urethra for reasons that will soon become obvious. Spongy urethra.
So what kind of things does the seminal vesicle secrete? You said that's what secretes also?
They produce some of those secretions that become part of semen. And we're going to get to that.
Okay.
So for instance, the prostate gland, the seminal vesicles, and the bulbourethral glands, those are the three accessory glands that produce semen. Okay, let's see. All right, so this is the testis. Here's the epididymis. And then this here is the vas deferens. And that's going to carry this spermatozoa out of the scrotum. If someone undergoes a vasectomy, they make a small incision here. They isolate the vas deferens, and they ligate it. You take a little suture and tie it at 2 points about 1 centimeter or so apart. And then what they're going to do after they ligate it, here and here, they're going to make a cut right between. So it's going to disrupt the passage of spermatozoa into the urethra. So that now if the male ejaculates, that ejaculate is going to contain fluid, seminal fluid, but no spermatozoa.
So where does the spermatozoa go? Does it just get reabsorbed?
That's right. It breaks down and gets reabsorbed.
Okay.
That's every time
Every time what?
that you ejaculate.
Right. And the idea is that none of those spermatozoa are going to pass into the female reproductive tract. And so it can't cause pregnancy. Now, notice the relationship between the anterior wall of the rectum and the prostate. This relationship is useful in performing a physical exam on the prostate. Okay? If you do a rectal exam and sweep your finger along the anterior wall, you can palpate the prostate, at least the posterior pole of the prostate, and you can get a good estimate of the size. For instance, the normal circumference of a prostate is somewhere analogous to the circumference of a quarter or maybe $0.50 at most. If it's larger than that, then the person has an enlarged prostate or prostatic hypertrophy. You can get a good feel for the consistency. A normal prostate is firm, but not boggy. If it's boggy, then we suspect infection, prostatitis. If someone were to have prostate cancer, you might feel hard nodules along the surface.
What is boggy?
What does boggy mean?
Boggy means fluctuant,
Okay.
where it gives. It's not as firm. And finally, if you do a prostatic massage, you can elicit fluid for examination under the microscope. So if someone did have an infection and you did a prostatic massage, you could collect the fluid, put it on a slide, look at it under the microscope, and you might see, for instance, buku white blood cells. So we talked about two of the types of glands. We said, okay, seminal vesicles are going to be present lateral to the ampulla of the vas deferens on either side. We said there's a single prostate gland here, and then these tiny glands, one of which is here, is called the bulbourethral gland. That's kind of embedded within the urogenital diaphragm, and has a little duct that empties into the penile urethra. The bulbourethral gland is no bigger than kind of a large pea. not your petit pois, your large peel pea. You know, sometimes when you buy a can of peas, the petit pois, by the way, tastes a lot different from the large peas. It's an entirely different food. Have y'all noticed that?
I prefer the patty pie.
I don't know peas.
I like the petit pois.
They're like baby peas.
What is the point?
Okay, this is the testis. I always remember the dimensions of the testis because they're very similar to the range for serum potassium levels. Serum potassium in the blood ranges from 3.5 to 5.0 milliequivalents per liter. Well, a normal testis is around 3.5 by 5 centimeters in width and height. So by using one, I can remember two things at one time with that one. Now the testis is surrounded by a tough white capsule called the tunica albuginea. And it's made out of dense connective tissue. The dense connective tissue capsule that's rich in sensory nerve endings. Okay. It's going to be very analogous to what we see with the ovaries. The ovaries is going to be surrounded by a dense fibrous capsule that's rich in sensory endings. Why do you think we have these sensitive capsules surrounding the gonads?
Protection.
Yeah, so you're protective. If it hurts, then you tend to protect them more because that's your genetic material that you're going to pass on to future generations. So everyone tries to protect their genetic material. Evolutionary, from an evolutionary standpoint, it makes sense. Now, when the testes descend, either right before or right after birth, they bring down with them a covering derived from the peritoneum. This is called the tunica vaginalis. That's kind of a two-layered structure. There's a visceral layer. And this is tunica vaginalis. And then there's an outer layer, which is called what? This is a visceral layer. What do you think this outer layer is? It's a parietal layer. So we'll see that the testis has a couple coverings. This is a different drawing, just showing the same structures. Just over it one more time. Here's the rectum, here's the bladder. By the way, you can see the urethral orifice. I almost asked this question: what is this region of the bladder between the two urethral openings? I'm sorry, ureteral openings and the urethral opening. It's kind of a triangular-shaped region between the two ureters and the urethra. You know what this smooth area is called? Trigone. The trigone. Very, very good. Trigone. And so, as we exit the bladder, urine is going to empty into this prostatic urethra. Here you see the membranous urethra, and here is the penile urethra, also called the spongy urethra. If we were to cut the penis in cross-section, we would see that there are three cylindrical bodies. These cylindrical bodies contain vascular sinuses that can accommodate blood flow. Okay? The upper two cylindrical bodies are called the corpora. Corpora is plural. Cavernosa. Corpora cavernosa. The ventrally located cylindrical body that accommodates blood flow is called the corpus because it's singular. Spongiosum. And it's the corpus spongiosum that carries the urethra. Let's find this. Notice that when you look at the penis in its longitudinal section, this dorsal part is one of the corpora cavernosa. This ventral area containing the urethra is the corpus spongiosum. Distally, the corpus spongiosum expands. Again, it's the corpus spongiosum that expands to form the glans penis. G-L-A-N-S, the glans. The glans penis has a tremendously high concentration of sensory receptors, tactile receptors. Okay. Why is that? Well, so that it can stimulate an erection. If you stimulate those receptors, it helps to bring about an erection. Why is an erection important?
Because it allows for you to procreate.
It allows penetration of the vagina so that then you can pass the spermatozoa into the vaginal canal. In fact, nature is amazing. Generally, the average length of a penis is very close to the average length of a vagina. Probably not a coincidence.